Hey guys, welcome and welcome back to World Nursing Lecture Room. Today we are going to look at some of the top 10 chronic illness that are the leading cause of death in the world. Is it in the world? Yes, but top 10 chronic illness. So the first thing that I'm going to do, I'm going to highlight them. So those top 10, we have heart disease, we have kidney disease, we have hypertension, we have cancer, we have obesity, we have arthritis, we have chronic kidney disease, we have liver disease, we have chronic respiratory disease, and we have the Alzheimer disease or other dementia disease. And yeah, those are some of the top 10. Yeah, top 10. I think they are 10 in numbers. Cancer, obesity, kidney disease, chronic respiratory disease, Alzheimer disease, HTN or hypertension, heart disease, arthritis, and which one? And liver disease. So, if you're in this channel, just know that we are going to talk about all those 10 diseases, those chronic 10 diseases. And today we are going to start with heart disease. If you just hear the word heart disease, that is what we are going to talk about. Heart disease is a combination of so many diseases. And before that, let us look at, when I talk about heart disease, it can be a problem with the septum, it can be a problem with the valve, it can be a problem with the chambers, it can be a problem with the blood vessels, the septum, the electrical conductivity system. So relax. It is big or it is long. Just stay tuned, like this video, share, comment, don't forget to turn notification bell so that every time I post a video, you will be the first person to be notified. So let's get into the video. So what you have to know is that human heart is a complex organ that is composed of several key components that work together to pump blood throughout the body. So here are some of the chambers or some of the components of the heart. Yeah, these are some of the components of the heart. I don't know where I'm going to put this thing so that you are able to see. So we have the chambers. Where we have, these are the chambers. I'm not going to, these are the chambers, arterial. The heart has two upper chambers that are called the left atrium and the right atrium. The left and the right atrium, they receive blood coming into the heart. We have the ventricles. The ventricles are this one. The two lower chambers are the left ventricles and right ventricles, and they pump blood out of the heart. We have the valves. The heart contains four main valves that prevent blood from flowing back, and it ensures blood move in the correct direction. So we have the blood vessels, the arteries and the veins. They're the one that pump and receive blood. We have the septum, that is a muscular wall that divides the heart. The septum, this one here, it is a muscular wall that divides the heart into the right and the left side, and it prevents mixing of oxygenated blood and deoxygenated blood. We have the pericardium. It is a protective sac, pericardium membrane. It is a protective sac that surrounds the heart. It surrounds the heart and contains lubricating fluids that help in reducing friction as the heart function or as the heart beats. We have myocardium. This is the thick muscle layer responsible for the contraction and the pumping of the pumping action of the heart. We have the electrical conductivity system. This system coordinates the heart rhythm, and I can say it includes the CA node and the AV node, sinoatrial node, and the atrioventricular node, and also the bundles of His and Purkinje fiber. So these nodes, the S, not C. SA node, it is the neutral pacemaker of the heart. It is located in the right atrium. AV node receives signals from the SA node and help coordinate the contraction of the ventricles. Also, the bundles of Purkinje and bundles of His and Purkinje fiber contract or conduct electrical impulses throughout the ventricle to ensure they contract properly. So what you have to know is that heart disease describe a range of conditions that affect the heart or that affect your heart. The diseases under the heart disease umbrella include what we have talked about: the chambers, the blood vessels, the myocardium, the pericardium, all those. Yeah, those the heart disease itself. The heart disease, the disease under the heart disease include all those things that we have talked about there. So the term heart disease is often used interchangeably with the word cardiovascular disease. So cardiovascular disease generally refer to the conditions that involve or narrowed or block blood vessels that can lead to heart attack, the chest pain, the angina, or the stroke, and other heart conditions such as those that affect your heart muscles, valve, or rhythm. And also they are considered form of heart disease. So many forms of heart disease can be prevented or treated through lifestyles. That is what you have to know. So let us look at some of the symptoms of heart disease. And remember, we are not talking about or just only one symptom. We are talking about symptoms of the heart in your blood vessels. We are talking about symptoms of symptoms that are caused by abnormal heart rhythm, symptoms that are caused by heart defect. Yeah, those. So let us start with the symptoms of heart disease in the blood vessels and your atherosclerotic disease. So cardiovascular disease is caused by narrowed, blocked, or stiffed blood vessels that prevent your heart, brain, or other part of your body from receiving enough blood. Cardiovascular disease symptoms may be different from men to women. Here, you have to know that. For instance, men are more likely to have chest pain. Women are more likely to have symptoms such as shortness of breath and nausea, extreme fatigue. So these are some of the symptoms that are related to heart disease in blood vessels: chest pain, shortness of breath, pain, numbness, weakness, or coldness in the legs or arms, or pain in the neck, jaw, throat, or upper abdomen. You might not be diagnosed with this cardiovascular disease until you have heart attack, angina, or maybe stroke or heart failure. It is important to watch the cardiovascular symptoms and discuss concerns with your healthcare provider. So cardiovascular disease can sometimes be found earlier or with regular exam. Let us look at some of the symptoms caused by abnormal heartbeat. We have racing heartbeat, tachycardia, bradycardia, chest pain, discomfort, shortness of breath, light headache, light headache, dizziness, fainting, among others. Also, we have heart disease symptoms caused by heart defect. You might get cyanosis, swelling in the leg, or infant may have shortness of breath during feeding, or maybe this infant can have poor weight gain. Heart disease symptoms are caused by weak heart muscles. Remember, we talked about myocardia. So here we will have breathlessness with exhaustion or at rest, swelling on the leg, neck, feet, fatigue, regular heartbeat, dizziness, light headache, fainting, among others. Heart symptoms of heart disease or symptoms caused by heart infection: pericarditis, myocarditis, endocarditis. Those are the heart infection. So symptoms might be held because of that infection. We might have fever, shortness of breath, weakness, fatigue, swelling in the leg, abdomen, changes in the heart rhythm, and also skin rashes or unusual spot. Heart disease symptoms caused by valvular heart disease. We have fatigue, shortness of breath, irregular heartbeat, swelling feet or ankle, or even cyanosis. When to see the doctor: seek emergency medical care if you have this heart problem. The following, or what I'm going to say: chest pain, shortness of breath, or even fainting. Now, what are the causes of heart disease? So before we talk about the causes, let us look at how the heart works. So your heart is a pump. Do you know what a pump is? Yeah, its work is to pump blood throughout the body. So it's a muscular organ about the size of the feet. This is the size of the heart that you are carrying. So it is situated in the left center of your chest. Your heart is divided into the right and the left side. The division protects the mixing of oxygenated blood and deoxygenated blood. So the right side of the heart comprises the right atrium, the ventricular, collect and pump blood to the lungs through the pulmonary artery. Now the lungs refresh the blood with a new supply of oxygen. The lungs also breathe out carbon dioxide waste product. So oxygen-rich blood then enter the left side of the heart, comprising the left atrium and the ventricle, and also the left side of the heart pump blood through the outer to supply the tissue throughout the body. So the heart valves, we have 4 valves within the heart that keep your blood moving the right way by opening only one way and only when they need to. To function properly, the valve must be formed properly, must open all the way and must close tightly so there is no leakage. When the blood enter, there must be no leakage or flowing back of blood. So we have the tricuspid, the mitral, the pulmonary, and the aortic valve. So heartbeat, a beating heart contract and relax in a condition in cautious cycle. So we have during the contraction, your ventricle contract. During the relaxation, your ventricle filled with blood coming from upper chamber will relax. So it contracts and relax. That is how the heart beats. Causes of cardiovascular disease. That is what I was to talk about, but I just wanted to brief something how the heart works. Yeah. Cardiovascular disease can refer to different heart or blood vessel problem. The term is often used to mean damage of your heart or blood vessel by atherosclerosis, a build-up of fatty plaque in your arteries. Plaque build-up thicken and stiffen artery wall, which can inhibit blood flow through your arteries to your organs and tissue. So atherosclerosis is also the most common cause of cardiovascular disease. It can be caused by correctable problems such as unhealthy diet, lack of exercise, being overweight, or smoking. Some of the causes of heart arrhythmia, we have the heart defects, coronary heart disease, high blood pressure, diabetes, smoking, excessive use of alcohol, drug abuse, stress, among others. In this heart disease, we are talking about heart, which is composed of so many components. And when there is a problem in one part or on one part, now the heart gets a problem, or it interferes with the normal function of the heart. So that is why when there is a problem with the blood, there is a problem with the heart. When there is a problem with the valve, there is a problem with the heart. Yeah, you get what I'm trying to say? The problem also can be caused by infection, bacteria, such as bacteria, viruses, or parasites. Among any problem, any defect, any problem on any part of the heart or any component of the heart interfere with the normal function of the heart. Yeah, so let us look at some of the risk factors of the heart. Heart disease. Age. If you are aging, you get high risk of damage and narrowing of the arteries and weaken and thicken of the muscles. So with age, nothing you can do. You can just live healthily to have a healthy aging. Sex men are generally at greater risk of heart disease. However, women's risk increase after menopause. Shindwe. Families, if you ever have any person with heart disease in your family, you are at a high risk. If you are smoking, nicotine constricts your blood vessels, and carbon monoxide can damage the inner lining of the blood vessels. So when you are smoking, you are at a high risk of any condition related to heart. Poor diet, high blood pressure, high blood cholesterol level, diabetes, damaging the blood vessels, obesity. Excess weight typically worsen the risk factor. Physical inactive, stress, poor hygiene. Let me say something about poor hygiene. Not regular washing your hands and not establishing other habit can help prevent viral and bacterial infection that can put you at risk of heart disease, especially if you already have underlying heart condition. So that is also another cause. Complications that may set in if you have any condition with your heart, any problem with your heart. You might go for heart failure. You might get heart failure. You might get heart attack. You might get stroke. You might get aneurysm. Aneurysm is a serious complication that can occur anywhere in your body. Yeah. Aneurysm is a plaque in the wall of your artery or in the wall of the artery. If aneurysm bursts, you may face life-threatening internal bleeding. Peripheral artery disease, also you can get that one. Peripheral, and also sudden cardiac arrest can occur. So how do we treat heart disease? Lifestyle changing, diet, exercise, managing stress, and also medication. We have so many medications which can help in treatment and prevention of complication. Also, we have medical procedure, surgery can be done, yeah, and you can just be okay. Also, we have some lifestyle and home remedies. We have, you must quit smoking, alcohol. You have to do exercise, eat healthy, remain with healthy weight, practice hygiene. Yeah, those are some of the things that you have to do when you are when you want to do what? When you want to prevent heart disease. I think I'm gonna stop from there. Let's meet in the next video.